My name is Dr. Mandar Nadkani, and I head the breast cancer surgery department at the Kokilaben Dhirubhai Ambani Hospital and Medical Research Center, which is a part of the cancer surgery department in Mumbai. I am very, very happy to be part of the Easiest Exam campaign by Zydus. This is a very great initiative that has been started that is increasing awareness of breast self-examination amongst women in today's day and age. This helps reduce the amount of treatment, improve cures, significantly helps reducing the risk of a woman losing her life to breast cancer. The last 120 years have seen breast cancer surgery evolve from a really miserable whole breast removal with muscle removal, a procedure called as radical mastectomy, to a modified radical mastectomy, to a breast conservative surgery. Today, what we do is a conservative surgery in a maximum number of patients. So for every 100 patients that I'll treat, I'll probably do a conservation in 85 patients where we will save the breast of the patient as part of the cancer treatment, and this is medically very safe a procedure to do, which gives the same cure rates as removal of the whole breast. The only addition that a patient needs to probably consider is the patient will need to take radiation therapy after the surgery as compared to a mastectomy. The natural advances, as we saw, moved from removal of the whole breast to saving the breast. And then once we realized as surgeons that the breast could be saved safely from point of view of cancer cure, we started doing more and more. So today's mantra is something that we call as oncoplastic breast cancer surgery, where we combine the principles of cancer surgery. So the principles of cancer surgery are not going to be diluted when it comes to removal of the cancer, and we combine that with principles of plastic surgery, where we are going to plan our incisions and we are going to do our mini and major reconstructions so that the cosmetic outcome is very good for the patient, because most of our patients are going to live for 25-30 years, breast cancer being a very, very, very highly curable disease, and it's a must that we give them a very good cosmetic outcome. In patients who undergo a mastectomy today, we have different ways of reconstructing the whole breast by using implants or a patient's own tissues like pedicle flaps or free flaps from the abdomen, something that is called as DIP, which gives very good cosmetic outcomes. And in patients in whom we do conservative surgery, if the volume of excision exceeds 20-25%, we are able to use local flaps from around. They are called as perforator-based flaps, and this is today the standard of care. So the mantra is save the breast, give an excellent cosmetic outcome, and do not reduce cancer outcome even by 0.1%. Early detection is extremely important. There have been many studies that have been done on early detection. There are three ways in which you can detect a cancer early. You can yourself check for a cancer, that's called self-examination. You on a regular basis can go and meet your doctor and get yourself examined once a year. That's a clinical breast examination. Or you can get it or you can catch a cancer by get it examined through imaging by doing a mammography and sonography. All three are considered to be very good tools for early detection. The most proven amongst them is mammography and sonography, that is recommended between 40 and 55 years of age annually, and after 55 once in 1.5 to 2 years, so that you can catch cancers before they can actually be felt to the hand when they are very tiny, whereby you require minimum treatment. So you don't need to take the breast out, you just have to take out the tumor. You don't have to take out the lymph nodes. You do a sentinel lymph node biopsy and you are able to save axillary lymph node dissection. So there is no swelling of the arm, there is no long-term morbidity for the patient. Early detection by any or all of these three techniques will help reduce the amount of treatment in terms of surgery, morbidity associated with the surgery, significantly reduce the chance that you may need to take chemotherapy as part of your treatment, okay, and give you the best possible cure rates, upwards of 90-95%. One thing that we can't ever forget is that a woman should be aware and catch her cancer early, because if she does not, then all these things really may not be able to help her significantly. So catching the cancer early is important. Early detection has been really promulgated by this initiative, the Easiest Exam campaign by Zydus, is one of the greatest initiatives that I have seen in the last few years. This helps women form a habit to catch their cancers early. Breast self-examination should be started at the age of 20, and you should be doing it once a month. No less than that, no more than that. If you need any help, please visit www.easiestexam.com, where we will be able to help you and we will be able to guide you nicely. All the best to all of you.